All right, guys. Sorry for the delay. I was enjoying the laser initially, so going to be doing some IV laser here today. I'm over at Wildwood Integrative with Pat Bauer, who has the Weber Endo Laser system here, which I'm hooked up to right now. The Weber Endo Laser has multiple different wavelengths of light that you can get hooked up to. Right now, I'm hooked up to the 635 nanometer wavelength of light. And you can probably see, let's see if I can get it here. So there's the light basically going through the vein and some of it being scattered out. So its acronym is RATS, reflection, absorption, transmission, scattered. So this is some of the scattered light. So you can see the red's going in right now. I'm going to get hooked up to the UV in a minute, and then the near infrared. So trying to build some exclusion zone water with this at the moment. So initially did a Myers cocktail, had a lot of IV vitamin C, B vitamins and such in there. Just kind of get an energy boost with that. But while we had the IV in, decided let's see what the laser would look like. So the red shows up pretty well. So, but when I go to UV, you won't be able to see it. So I always thought it'd be funny to show people this part. But so this is for patients who, for the most part, have more serious conditions. They have really bad cardiomyopathies, weak hearts, autoimmune conditions. Some like a malignancy that needs adjuvant treatment other than radiation and chemo. Pat Bauer here at Wildwood Integrative has had this device for the past couple of years and has some very great anecdotal reports of patients doing better using these type of technologies that help support the body's system to make energy. So this Weber device helps with mitochondrial function by doing IV photobiomodulation. So photobiomodulation, so that's using light to modulate your biology or change your biology. So most of the time this is administered through topical treatments, so either a panel or a cluster probe that you press on the skin. But this IV blood irradiation is a fairly novel use of the technology. Very, let's say, popular more in Germany and Russia. There's probably only a handful of these units in the United States, and fortunate enough that St. Louis has one of them, and Pat's an expert at running this thing. And this is probably the third time that I've hooked myself up to it. But I tend to use it more just for just general well-being and just to see what the features can do. So there's different wavelengths you can use with it. I am choosing red to build an exclusion zone or structured water in the lumen of my veins at this moment. And then we'll hook up the UV to expand the exclusion zone. So the more structured water that you can hold on to, the more energy you can store. So I think Pat's probably coming back in, and we'll maybe let her chat a little bit about it. I'll tag you in this, but this is Pat, so just
Hi.
wait. So you can just tell them what this is and what you've been doing.
Sure. So this is a Weber endo laser, and we can get light into the body 3 different ways. We can go transdermal, we can go intra-articular, or like Dr. Twyman's getting, we're going intravenously. So he's got red in, and we're about to switch him over to ultraviolet, and ultraviolet kills pathogens. So whether it's a bacteria, virus, fungus, or parasite, this wavelength of light will eradicate those pathogens that come in contact with it. And then the immune system gets the picture, gets the message, okay, let's go after these. So it's a gentle way to get people's body to do their bodies to do the work. So we'll switch right now.
Mm-hmm. So in a second you can see the red light go off, and it's going to go to UV, which obviously you can't see with your own eyes. So it's going to look invisible for a moment.
But on with the camera.
Sometimes you can see the purple, can't you?
Yep. Sometimes we can see that.
Maybe.
So go stop. 7. goes.
So now the UV is going in to kill all the crazy viruses I probably have in my system right now.
Maybe if I turn this light off, maybe
Sometimes you can see the light through the fiber optic cable, but if not, it's structuring the water. I wore the purple shirt just in case. So. How did you actually get interested in this type of technology?
I was doing some research on several patients who had chronic elevated Epstein-Barr, cytomegalovirus, just chronic conditions that they couldn't get rid of, and they were feeling the ill effects of just long-term assault on their immune system. And I read a study about photobiomodulation, and it kind of piqued my interest. And then I read 3 or 4 more, and one of them was co-authored by Dr. Weber, whose machine I have, and I just kept going down the rabbit hole. And I actually emailed him because his email was at the end of the article, and I asked, how do you get a hold of this machine? And he actually called me, and he speaks English very well, but I'm like, Dr. Weber, who do I know? And it took me a second, and then I thought, oh my goodness, he invited me to the ISLA conference, the International Society of Laser Application, and I went, and from that point on, I bought his machine. I use it most often I'm using it intravenously, secondarily, topically, and lastly, the intra-articular. So once I got to reading about light and how light reacts with cells and blood cells, the bug bit.
Yeah. So, who are the kind of ideal type of patients that you usually use the intravenous on?
The chronic infections. Obviously, I get a lot of chronic Lyme, and those folks have lots of co-infections. So they'll come to me and they'll say, "Well, I need to be tested, and I need to know what I'm going after." And I said, it doesn't matter. I mean, we can test you till you're poor. We really can. But my treatment's going to be the same, which is to beef up your own body's immune system action. And many times for them, what I'll do is the major autohemotherapy, where I will take out about 240 cc's of their blood into a bag with 240 cc's of normal saline, and then I put in 240 cc's of ozone gas. So the ozone is the T lymphocytes cleave to the ozone, and it's absorbed almost immediately. So then we hang that bag back up, give their patient their blood back, and then do what you're doing. And it takes 4 to 8 to 12 of those for people to be well. Are their titers going to be visible? Yes, but the difference between high titers when they first come in and maybe high titers after 8 treatments is that they feel good.
Sure.
Yeah, I mean, we're always going to be able to see most of what they've been exposed to in titers. So chronic Lyme, I use this most recently in people with there's another way to get light into the body. I had a patient a female who had bladder cancer, and she was she was up against surgery to remove an elliptical portion of her bladder, and I had read a study by Dr. Weber, and he was using a cylindrical laser. So instead of the light coming out the end, the light was coming out in a cylinder that's about 2.5, 3 inches long. And so I gave this woman, she got curcumin, and she also got chlorophyll. That's orally about 20 minutes before I put this cylindrical laser in the catheter, inserted the catheter into the bladder, and just turned down the laser. It's annoying to get a catheter put in, but it's painless to get the light treatment. And when she went to to her surgery, she came out, and the doctor didn't need to remove any part of her bladder. Said he saw some remnants of what they thought was cancer. She's happy, and I smile. And the doctor didn't want to know what she did, and that's fine. She got better.
Right.
Let's see, who else? If I have some breast cancer patients where we can palpate the tumor, and I'll give them the same chlorophyll and curcumin regimen, and then just topically apply the lasers. And these women, they aren't progressing. I can't say that things are turning around for them, but usually with breast cancer, people progress pretty systematically, and these women are just holding their own. So I got to go do some more research.
So you'd mentioned the chlorophyll and the curcumin, so that's known as photodynamic therapy. So how does that actually enhance the use of the laser?
Those are the photosensitizers. Curcumin is activated by
to be more the blue, probably.
Blue, yeah. Curcumin goes blue, and chlorophyll is red. And what they're doing is upregulating the action of our cells. So when we're introducing the lasers intravenously, we're affecting the blood, which then circulates into every part of our body. Interestingly, from what I've read, the photosensitizers are absorbed in greater intensity in cancer cells. And so when that irradiated blood comes through the cancer cell, they're either switched off, or they don't grow anymore. And so I've seen some pretty interesting results with people. I don't have good studies yet. I do have one woman who, because of the type of cancer she has, I can't give her fluids because she's getting ascites. And so what I've been doing for her is using a photosensitizer called poly-MVA. That goes in, she's taking it orally at home, and then I have it compounded. It goes in intravenously, and then we use we use blue, green, and yellow. And her CA-125, which is the marker for her type of cancer, when she first got diagnosed, it was 2,800. After a month of oral at home and 4 of these treatments, her CA-125 went down to 1,600. So a huge
awesome.
drop. But I haven't seen any CTs or anything like that because she has to work in the medical world, and I kind of sit back on the side.
Sure. So, have you seen any patients for any cardiovascular conditions? I know there's one patient that had a cardiomyopathy you were treating in the past. Are some of those patients finding you with this?
Not too many yet, but with your help, I'm sure they'll be here. I'm open to anybody who has an idea. Like we were talking previously, sometimes what we do, it's so specific that you have to study it. You have to make sure you're not going to hurt someone. And it's not that I couldn't hurt someone with this, but it's so gentle that even if I only gave someone 10 minutes of a certain light, or let's say I went over and I gave them 15, I'm not going to hurt them. And so I can be a little, I can have I have the flexibility to say, oh well, let's try this for 15 minutes instead of 10, knowing that I'm not going to be dealing with a side effect. And that's kind of, it's nice for someone like me, because I operate out here kind of in the desert, but I have all my friends and I appreciate them.
Sure. And if people are more interested in learning about this or coming out to work with you, how's the best way for them to reach you?
First would be to go to my website, which wildwoodintegrativehealthcare.com, and I've explained all the therapies that I have, and so look those up, see what's of interest. To become my patient, they need a new patient visit. Right now it's about 8-9 weeks to get to see me. I recently hired a nurse practitioner who thinks like me, so you can get into her quicker. And if people know what they want, what's interesting now with what you do and what I do is that people can almost self-prescribe, and we get to watch them, we get to steer them, we get to look at their progress, and it feels good to the patient, because nothing's worse than a patient who doesn't know why they're getting something, doesn't understand what's next, and feels bad.
Sure.
And what we do, if they don't feel better, we know there's something else we have to try. And so when people have the opportunity to come in and say, you know what I really want? I want to try that laser thing. Or can I just come get vitamin C? Sure. I mean, I know how to do that safely, and I know how to dose it, to say, well, let's get you 4 of these, or I work with people. I also work with other nurse practitioners. I work with doctors. They'll tell me, I've got this person who I just can't get better, and so we work together to come up with something to help people live their life, because their job is to live their life, not to be in my chair.
Sure.
And that's my goal for them, is that they get to live life.
That's awesome. Well, you're very much appreciated in this community, and you're a wealth of knowledge on this. And if you guys want to know more about this, I'll tag Pat in my stories here, and get you in touch with her. So I think we're about done with the UV, and I think I'm going to get hooked up to the infrared now. So I'll probably let you guys go, but I'll show you what this device looks like and see if she shows us what it's like little probes look like. So there's all these different little diodes up here. It looks like the flux capacitor out of the DeLorean.
The DeLorean.
Yeah. So we're gonna get switched up here and pop off the UV and put on the near infrared. So probably get banned off of Instagram for showing this. So again, you're not going to see the light going through the fiber optic cable here, but the 810 nanometers, when it's applied topically, will penetrate bone, and this is one of the most useful wavelengths of light for brain photobiomodulation. So if you've seen me wear that crazy bike-looking helmet, It's the same company that makes this IV laser. Weber makes a helmet. Pat out here has that helmet as well. But remember, my caveat on that one is make sure you know what you're doing with those ones. You can't overdo it with the helmets from personal experience. So start very slow with those ones if you get that on your own. Otherwise, work with somebody who knows what they're doing with that type of device. But I'm going to let this go in here and get unhooked here, and I'll be back on with some feedback